Hey everybody, Dr. John Nunez here, Feldman Physical Therapy and Performance with Dr. Justin Feldman, and today we're bringing another episode of our frequently asked questions. Hopefully last week you caught our episode regarding plan of care follow-up visits and what you can expect. And today Justin's going to talk a bit about discharge and our discharge criteria. How do we know you're done? How do you know when you're done? So Justin?
Yeah, so a lot of times people come in and physical therapy is fun, but they don't always want to be here. And everyone's anxious to get back to what they love doing and what they want to do. So we're anxious to be able to get them back to that. So when it comes to discharge, we are really big believers in using a lot of science behind figuring out when you're ready to get back to different things. So we'll lay out in your first visit some benchmarks that we're looking for, and I like to try and give people an idea on that initial visit. Okay, these are some benchmarks that we're going to look for, and when you're able to do this, then we're going to start to add that. So maybe if it's a lower leg injury, I might say when you're able to stand on one leg for 30 seconds, then we might try and get you to hop. And when you're able to hop, we might try and get you back into running or jogging and these things. And so we use that. We also utilize the Y balance test a lot. So that's a really good way, research-based approach to figuring out when you're ready to return to play and start getting back to contact, especially different types of agility-based sports or field sports. So we like to use that a lot. The other thing I like to talk to people about is the idea that we don't ever like to discharge a patient. So this is not like the hospital where you're going to get discharged and we hope to never see you again. We hope to never see you injured again, right. But I really like to follow up with my patients on somewhat of a regular basis, and that doesn't necessarily mean on a monthly basis or even like every other month basis. Might even be every 3 months, but you're gonna go to your primary care doctor, get a checkup once a year. You're gonna get the oil changed in your car every, I don't know how many miles it is now with these new cars, like 10,000 miles, something like that. Something, I think sometimes you just buy a new car. You're going to go to the dentist every 6 months, and we like to do a movement checkup on people and see what's going on and see maybe if there's things that have evolved since we saw them last that we might be able to pick up on. And I don't even really want to say predict a future injury, but I more like to say we might pick up on some inefficiency, and if we pick up on it early, it can avoid a future injury.
Yeah, that's pretty good. Yeah, I mean, honestly, we don't even like to use pain as kind of our benchmark or reference, because pain is kind of the last thing to come and the first thing to go away a lot of times with injuries. So we don't use pain. Once it goes away, it doesn't mean you're done. There's a lot of other things entailed. So just like Justin said, that maintenance work and routine follow-ups every now and then is definitely not a bad idea. So
yeah, pain can hide a lot of things. So you're in pain, it's going to hide a lot of things that might need to get fixed. So once you get out of pain, sometimes we even can find some more stuff to work on and make things even better. So that's what we got for you guys this week. Have a great week, and we'll see everybody back here next week.